I'm Dr. Chris Pagnani. I've been an instructor at the Johns Hopkins Hospital for the Department of Psychiatry and Behavioral Sciences since 2012. I have supervised residents of psychiatry and young physicians at Jefferson Hospital since also about 2012. I'm the medical director and founder of Rittenhouse Psychiatric Associates, which is a network of academically oriented psychiatrists, psychiatric nurse practitioners, and psychotherapists who provide in-office and virtual psychiatric care throughout Pennsylvania, New Jersey, and others. And then I have my own personal private practice of psychiatry in Philadelphia and Paoli, Pennsylvania on the main line. And then I can deliver care to patients living in other locations as well, as I'm licensed in New York, New Jersey, Pennsylvania, Maryland, Delaware, Florida, and California. And care to those other locations is dependent on appropriateness for virtual visits and also state rules and regulations, which are often changing. So if you have any questions, just call our office. Amy's really fantastic, and she'll be able to discuss whether we can schedule you for a visit based on your unique circumstance and location. I treat patients for anxiety disorders like generalized anxiety disorder, panic attack disorder, OCD, mood disorders like major depressive disorder, dysthymia, bipolar disorder, and others, ADHD, and then also substance use disorders like alcohol use disorder and opiate use disorder. When asked what type of care I deliver, I really strive to be as thorough as possible, conscientious, evidence-based, and holistic. And so while most patients who are part of my practice are on a psychiatric medication, medications are not magic bullets, right? So if someone has severe illness, then they may really need to be on a medication. It may make a huge difference for them. However, for the average person that's seeing one of our providers, really, there are so many other things at play. And while medication may be helpful for them, I really strive to understand their life story and any history of traumas or life circumstances that are affecting the way that they feel, whether that person has any temperamental vulnerabilities that could be affecting the way that they're viewing the world, or the way that they react to certain things, and then also any behaviors that could be playing a role or making things worse, and that could be substance use, or it could be positive behaviors like exercise and diet and yoga, meditation, and things like that. Patients will often see me for an initial visit, and then they may choose to transition to one of the nurse practitioners in the practice, which certainly is an option. And if there's any other questions that you have about the practice, please don't hesitate to call. As mentioned, Amy, our office manager, is really fantastic. She'll pick up the phone and answer every questions you have.